guys, thanks for clicking on the video. The human anatomy and biomechanics of what we can do with our body is a very complex thing that has a lot of different basically things going on, and I think there's a lot of information to get caught up in. So in this video I hope to kind of make things a little basic, not necessarily dumb them down, but just make it a little easily digestible for the common viewer and potentially somebody who's just studying this for the first time. So if you like these types of videos, please like the video and comment and subscribe, and thanks for watching. We'll catch you in the video. The first joint that we're going to look at is the shoulder joint. The shoulder joint is a ball and socket joint, meaning that there is a large degree of motion that can be attained with it. Because of this, though, there is also a large degree of instability and potential injury with the shoulder joint. The first shoulder motion we're going to look at is shoulder abduction. Shoulder abduction is simply when the arm moves away from the midline of the body. The first few degrees of shoulder abduction are initiated with the muscle called the supraspinatus. This is one of your rotator cuff muscles. The rest of the movement is completed with the use of the medial deltoid. The next movement is shoulder adduction. Adduction is simply moving your arm towards the midline of your body. A simple way to differentiate between adduction and abduction is that you are adding the limb back to your body. So in this case, we're adding the arm back to your body, hence shoulder adduction. Shoulder adduction is something that I've always found interesting because the two primary muscles used in this, the pectoralis major and the latissimus dorsi, are typically referred to as opposing muscles. Usually the pectoralis major is involved in pushing movements, while the latissimus dorsi is involved in pulling movements. However, in this case of shoulder adduction, both muscles are used simultaneously to complete the movement. The next shoulder movement is shoulder flexion. Shoulder flexion is involved when you bring your arm up in front of your body and attempt to go overhead. Shoulder flexion is an incredibly important marker in overall shoulder mobility, as people who've had shoulder cuff injuries may not be able to do that much shoulder flexion. The two primary movers in shoulder flexion are the anterior deltoid, anterior meaning the front of the body, and of course the pectoralis major. Shoulder extension is the next movement, and although a small movement, it is still very important. Shoulder extension involves bringing your arm down by your side straight back behind your body. Shoulder extension is executed through the use of the latissimus dorsi and also the teres major. Teres major is often termed the little lat or tiny lat because many of the movements that your latissimus dorsi does, the teres major assists with. The next movement is horizontal shoulder adduction. Horizontal shoulder adduction uses the same muscles as shoulder flexion, being the anterior deltoid and the pectoralis major. Although the same muscles are being used, it does differ in that your arms are being brought out in front of you as if you're clapping your hands. Horizontal shoulder abduction is the reverse movement of adduction. This uses the posterior deltoid as well as the latissimus dorsi. A good way to think about horizontal shoulder abduction is trying to pinch your shoulder blades with your arms straight out to your side. Next up is external rotation of the shoulder. External rotation of the shoulder is kind of a hard exercise to cue, so the best way I think of this is by creating a 90-degree angle with your elbow and trying to pin it towards the side of your rib cage. Then with this, I want you to try to bring your wrist as far out to the side while keeping your elbow intact with your ribs. Although an extremely small movement, shoulder external rotation is extremely important for overall shoulder health. Having poor shoulder external rotation will likely show with a lack of ability to bring your arm overhead. Your infraspinatus and the teres minor muscle are the two small rotator cuff muscles that provide external rotation in the shoulder. Shoulder internal rotation is also very important. If you use the same cues as the last time, we're going to start by having our elbow close to our side at a 90-degree angle. With that, you're going to start with your wrist away from your body and then bring it towards your body. Similarly to external rotation, this movement is also important for overall shoulder health and shoulder mobility. The prime movers in shoulder internal rotation are the subscapularis, which is one of your rotator cuff muscles, and also the latissimus dorsi and pectoralis major. Shoulder circumduction is a fancy term for being able to combine all those movements we just listed. We are now going to move into your neck or your cervical spine. The neck is composed of both pivot and synovial joints. Assessing movement in the cervical spine is important for addressing numerous postural issues. The first neck movement we're going to look at is cervical flexion. Cervical flexion is simply by bringing your chin down towards your neck area. Another way to look at this is by making a double chin. Cervical flexion's primary movers are the sternocleidomastoid and the anterior scalene muscles. Moving into cervical extension, this is where you bring your chin up to the sky as much as you can, or basically nod your head upwards. The two main muscles in this movement are the splenius cervicus and the splenius capitis. Cervical rotation of the spine is interesting in that it does not use the synovial joints, but rather the pivot joint at the top of the head. This is done through the pivoting of the C1 and C2 vertebrae in the cervical spine. The muscles that help in this movement are the spinalis capitis and the spinalis cervicus. The last of the neck movements is lateral cervical flexion. This is done by trying to bring the same side ear to the same side shoulder. This movement is primarily done through the use of the sternocleidomastoid muscle. The next joint that we're going to look at is the elbow joint. The elbow joint is a hinge joint and provides us with a few different movements that are extremely beneficial for us. The first elbow movement we're going to look at is elbow flexion. To make the explanation as simple as possible, elbow flexion is basically when you start with your arms straight and bend them to any degree. Elbow flexion's primary movers are the biceps brachii, the brachioradialis, and the brachialis. Another important movement is elbow extension. Elbow extension is done by starting with your arms in a bent position and then straightening them out to any degree. The prime mover of elbow extension is the triceps brachii. Forearm supination is another movement done with the musculature around the elbow. Supination is done when you start with your hand face down and then move it to a face up position. Forearm supination can be done with two different muscles depending on your elbow position. If your elbow is in a flexed position, then the biceps brachii will do most of the work in supination. If it is in an extended position, the supinator muscle will actually do most of the work. As we look at this video, my arm is in a flexed position, meaning that the biceps brachii will do most of the work in supination. The last elbow movement is forearm pronation. This is done when your hand starts in a face-up position and moves to a face-down position. The movement is done through the use of the pronator teres muscle as well as the brachioradialis. If you're getting confused between the difference of pronation and supination, a good way is to look at your hand position. When your hand position is faced up, this is when your arm is supinated. When your arm is supinated, you're able to hold a bowl of soup. This is how I've always remembered it and is a good mnemonic to remember supination and pronation. Lastly, we're going to move into the wrist joint. The wrist joint is a condyloid joint, meaning that there's a large degree of different ranges of motion that can be attained. The first wrist movement is wrist extension. This is when you start with your wrist in a bent position and straighten it fully. The three main muscles used in wrist extension are the extensor digitorum and the extensor carpi radialis and ulnaris. Moving into wrist flexion is when you start with your wrist in a straight position and move it into a bent position. The primary muscles used in wrist flexion are the flexor carpi radialis and the flexor carpi ulnaris. The last wrist movements we're going to look at are the side-to-side motion of the wrist. The first one being radial deviation. Radial meaning thumb side of the body. The main muscles used in radial deviation is the abductor pollicis longus. Another way to think of radial deviation is also wrist abduction. The opposite movement of the wrist being ulnar deviation, ulnar referring to pinky side. Ulnar deviation primarily uses the extensor and flexor carpi radialis. And just like the shoulder, the wrist can also circumduct, meaning a combination of all those movements that we just listed before. That's the end of the video. Thank you guys for watching. I plan on making another lower body anatomy and biomechanics video in the near future. So hopefully you enjoyed the video, learned something new, or potentially just brushed up on some basic biomechanics and anatomy that you learned at one point. If you did like the video, please like, comment, and subscribe, and we'll see you in the next one. Thanks.